This month is the month of breast cancer awareness. And therefore, I thought it well that I should do the awareness using this YouTube channel so that each and everybody can get this information. And therefore, for those who haven't subscribed to this YouTube channel, kindly do so. Share this information. It's going to help your relative. Share this information. It's going to help your sister. Like this video. Comment. Leave a comment. Let know what we need to do in the next topic, and also what you need to hear from us. So just leave a comment also. Now, when we talk about the breast cancer, this is a malignant tumor. When I talk about the malignant, I mean the cancer that can spread from one part of the body to the other. Breast cancer is the most common in women. Even men can have this breast cancer, but again, is most common in women, and the second most common cancer that causes death worldwide. Therefore, when we talk about this breast cancer awareness, it's something that is serious that one should be, should understand and should get screening each and every year to avoid late diagnosis. Now, the breast is just a tissue, on the chest. And this breast has a lot of functions also. It contains milk producing cells, the ducts. And this cancer usually originates from these duct and lobules. So therefore you can have what we call the ductal adenocarcinoma, or the lobules carcinoma, Msenia's carcinoma. All these are the types of malignant tumor that can arise from the breast. Now, for a woman to avoid late diagnosis and management, the woman should understand about the screening, self-breast examination, and also seeking medical attention. This is going to help this woman to get rid of this late diagnosis and what we call the management. However, the woman also should understand or should be aware of the signs and symptoms of this breast cancer, so that when she does what we call the self-breast examination, she knows what she's looking for. Now, one is the breast pain. You experience a pain on the breast, maybe both or one breast. It has not been there. It is something that has suddenly started, So this is also something that you should be aware of. The other thing is what you call the breast lump, a swelling on your breast, changes of the breast shape and even the size, an abscess, swelling, and other inflammation, the redness, skin changes, all these, nipple discharge, all these are some of the signs and symptoms of breast cancer. But again, it might be asymptomatic. Most of the women usually don't show any signs. Therefore, that's why we advocate for screening each and every year to avoid this breast cancer late diagnosis. The other thing that we should know is that there are those women who are more at risk of getting this breast cancer. Age is also another risk factor for you to get breast cancer. You are near or you are at menopause, you are more likely to get breast cancer. That's a risk factor. Age predispose you to have this breast cancer. The other thing is what we call the gender. If you are a woman, you are more likely to get this, breast cancer. Even men get, but it's not more common like women. Now, the other thing is what we call the some exposure to some of the radiations that may destroy also the breast. The other thing is obesity. It's also a risk factor. The other thing is what we call the, if you have the family history, genetic genes that are gonna cause this breast cancer, the BRCA1 and 2, you're more likely, or they're linked to breast cancer. Now, you go for the screening, you need to know about the breast self-examination. The breast is divided into 4 quadrants. Assuming this is the breast, it's divided into 4 quadrants. We have the upper quadrant and the lower quadrant. Now again, we have the inner and the outer. So the outer and the inner quadrants. So these quadrants, what you are looking for. We have talked about the signs and symptoms of the breast cancer. Maybe you start from the inner quadrant, the upper quadrant or the lower. You do the massage, you do the massage. What are you looking for? For any lump, any pain. If you feel pain somewhere, then you note it. You also make sure that you examine your, what you call the nipple. You might be having discharge. You are not a lactational mother, you are not, maybe during this menstruation, you can have some nipple discharge due to hormonal. So you need also to check for the lump, you need also to check for the pain, and you need to examine yourself, what we call the axillary. What are you looking for? The nodes, lymph nodes. This also may tell you that there's something continuing in your body. Hello, are we together? Now, once you do this, you'll be able to know what you need to do. You'll be able to go to the hospital for a checkup. If you feel hand pain, there's a nipple discharge, you examine, you look your breast, and then you realize that there is a, shape, retraction of the nipple. The shape is changing totally. There's a lot of pain. You are experiencing some, skin changes. You may be having some skin itchiness. There's a swelling, there's redness of the skin. Then you need to go to the hospital. You can do this maybe in a week once when you're gonna take the shower, either you stand, or you can do it in a mirror when you are standing or when you are seated. You can still do this. Now, once you have checked yourself, and maybe you come up with 1 or 2 signs and symptoms, you need to go to the hospital for further examination from the doctor, and also what you call the other investigations gonna done for you. Maybe you may need an ultrasound if it's available, breast ultrasound, a mammogram is available to you. If it's really available, you can do a mammogram, and this is done for women above 35 years of age. The other thing, after all this, fine needle biopsy may need to confirm further if it's, cancerous or anything else, because not all the pain, not all the discharge that are going to be cancer. Hello. So now, once the fine needle biopsy has been done, maybe for further clarification, if this is, if you have high suspicion of this cancerous, all these things are gonna be done to you. Even breast magnetic resonance imaging can be done to you. Now, maybe if the diagnosis is gonna be made of the breast cancer, again, the staging is needed to be, there must be staging. The doctor must know the staging Or again, you're going to be referred to an oncologist, you're going to be referred to a specialist for further management after the staging, so that the staging can be made to you, so that you can be able to get the treatment according to staging, according to the available resources, your prevalence as a patient, and even the pathology. You may be stage 1, A, B, stage 2, A, B, C. All those stages are going to be made to you. Now, if this tumor is less than 5 centimeters, you are more likely to get maybe some surgery gonna done to you, partial mastectomy, total mastectomy, lumpectomy, chemo, radiotherapy. If it's just a locally advanced, tumor that's greater than 5 centimeter, the adjuvant surgery gonna be done to you, chemo, radiotherapy. Metastatic, tumors. The tumor has gone to the other parts of the body. It's on the chest, on the lungs now. The CT scan has been done, and maybe it's on the lungs, it's on the other parts of the body. Maybe more likely you have immunotherapy, hormonotherapy, radio, all those. So the treatment, it will depend on the staging. You can get surgery, you can get chemo, immunotherapy, you can get what we call radiotherapy. All this mode of treatment is all according to the available resources and what we call the your prevalence as a patient, and also what we call the staging. Now again, if you find this video very helpful for you, kindly remember to share this information. As I said earlier, this month, the month of October, is the breast awareness, breast cancer awareness month. Therefore, I've given the signs and symptoms. I've taught you on how to do what we call the self-examination, and you need to go for screening regularly to avoid late diagnosis and management. Now, like this video also, remember to leave a comment, share the information, and we'll continue making these same health and wellness videos. Remember to continue supporting us also as we continue making these videos. Thank you. See you in the next topic.